Welcome everyone to the committee meetings for Wednesday, September 1st. Start off with health services.
Good evening, everybody. This is the Health Services Committee meeting at 6:02 p.m. Going to start the meeting with an update on the opioid response in Greene County. I believe we're going to have Laura and Jason come up here.
So thank you all for having us. We're really delighted to be asked to give an update on the opioid crisis and the efforts in the county to address it. Dr. Churchill and myself are the ones presenting to you tonight, but this was really a group effort by a lot of different agencies in the county. Representatives from those agencies are actually in the back row here. So I want to thank all of them for their input as well. Am I doing this? Am I making the PowerPoint go away? All right. Someone's good. Am I good?
I think that's what it's all here.
Where's your computer?
Point towards the computer.
It worked in our practice session. No. Okay, you can do it. There it goes.
As I said, it's a joint effort to outline the work of all of our different agencies and how we're addressing addiction and reduce overdose death with the overall goal of achieving a healthier community. So what is addiction? We have a short video we'd like to show, and this is an important video that we would like to we want to share because it really speaks to the complexity of addiction. It helps to explain how addictions affect us on a physical and psychological level, and how an addiction can actually essentially take over our bodies and our minds for that matter. So it's a short video. I think it's very so if we could just have your attention to that video, it would be great.
And Mary Jo can start.
What is addiction? It's also called a substance use disorder. Over 20 million people nationwide suffer from addiction. 1 in 7 people will experience addiction at some point in their life. Scientists first began to understand addiction as a brain disorder back in the 1950s. Doctors Olds and Milner in laboratory studies of rats found parts of the brain affected by addiction. But then in 1994, Drs. Volkoff and Shelburne, top neuroscientists, ran PET scans of the brain that showed the effects of substance use disorders. And like other diseases, these scans showed it affected tissue function. So there are 2 main parts of the brain affected by drug use, the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here. That's the prefrontal cortex, which is what separates us from other animals. And this is where decision-making and impulse control live. When drugs or alcohol are used, they activate the very same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens the system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. So why don't all people who use alcohol or drugs become addicted? There are factors that contribute to the development of a substance use disorder. They include individual factors like your genes, your age of exposure, and then environmental factors like drug availability. But there is good news. Addiction is preventable. Key factors that aid in preventing addiction can be categorized into two parts: risk factors and protective factors. Protective factors range from parental involvement, programs that improve self-control, limiting availability, and increasing attachment to your community. Another key element in preventing substance use disorders is to delay when use begins. Put simply, prevention is about delaying the onset of first use. In the adolescent brain, where brain tissue is more vulnerable, the hijacker is more prone to weaken the brain and plant itself as a disease. Those with substance use disorders commonly initiate first use much earlier, between 12 and 18 years old, which increases the likelihood of the hijacker taking hold. But if the hijacker does take hold, addiction is treatable. Advancements have been made in assessments, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is. Together, we can solve this. Join us.
So we wanted to show this. We thought this was important to show because it really shows that there is a science behind addiction and that it's much more complex than simply a choice that someone might make. It also helps to underscore the fact that many people in our community here in Greene County are also being affected, and their addictions may be started or escalated by prescription drugs as well. There is a very high incidence of prescribing of dangerous prescribing levels in Greene County as well. So it's important to understand the complexity of addiction itself. So Greene County, unfortunately, Greene County is not doing well with regards to the opiate epidemic. These figures show what's referred to as the opioid burden, and that is looking at a number of factors, including opioid overdose deaths, non-fatal outpatient emergency department visits, and hospital discharges involving opioid overdose, abuse, dependence, and unspecified use. So the dark blue are the counties that are hardest hit. Greene County is one of them. In a recent study, when they looked at the opioid burden in Greene County, it was 33% higher than the rest of the capital region and 45% higher than the state as a whole. So Greene County is hit very hard. This is state opioid data dashboard. It shows overdose deaths involving any opioid in Greene County over the years. You can see along the bottom it increased the years. So in 2019 there were 9. In 2020 there were 14. In 2021, as of July 31st, we were already up to 11. So that number is increasing each year. This also shows, those are the deaths, but this shows overdoses. Not all overdoses result in death. So here you can see it broken down also by drugs. So the blue shows prescription drugs, the red is heroin, fentanyl, and other opiates, and the yellow are drugs not listed. You can see, for example, in the highest one there, 2020, we were well, just with heroin, fentanyl itself, we were well over 75 overdoses, plus the others as well. So this year, in 2021, we're not on a good track now at this point as well. So what are we doing? This is what we want to talk about in the presentation. These are the different agencies involved. We have Greene County Paramedics, Columbia Greene Clubhouse, Youth Clubhouse. We have Twin County Recovery Services and Greener Pathways, Greene County Mental Health, Greene County Public Health, Mental Health Association of Columbia Greene County, Mobile Crisis Assessment Team, and the Greene County Sheriff's Department. All of us are working together, and what this will show is a lot of all the various efforts happening in the county by these different agencies. We broke it down into these 4 areas of prevention, intervention and treatment, harm reduction, and support and recovery. So what's prevention? Prevention is the action of stopping something from happening or arising. Okay. So for prevention, there are a number of services. There's certified recovery peer advocates. This is a relatively new certification for people that can be trained, that have lived experience with addiction. Okay, so they might be someone that's in recovery that can get a certification with the state, and they can serve as the certified recovery peer advocate. You might hear us refer to them as peers. That's what we're referring to when we say that. And they can be helpful in a number of ways, especially like with number 3, for example, which is linkage to treatment centers, services, and supports. So they might help someone find their path to the right treatment services that they might need, or different supports that they might need. I don't want to skip number 2. Number 2, we're providing, there's prevention services and prevention counselors in schools, hitting grades 7 through 12. There are youth support groups and activities at the youth clubhouse. There are health and prevention educators in the county as well, providing health and prevention education. There's the availability of medication destruction bags, which are these bags that are available and that can be distributed for people to destroy and make inert any medications they might have in their house. Maybe they have leftover painkillers from a surgery. They want to get rid of them so they're not used or misused or stolen. There are medication destruction bags for that purpose. There are also medication take-back events, and then there are syringe disposal kiosks around the county as well. For intervention and treatment, so there are post-overdose responses. So when an overdose happens in the county, there are services that go out and do outreach to those folks. The first is the Greene County Sheriff's Office Impacted Citizens Program. There's also the Greene County Paramedics Leave Behind Naloxone Program, where they would go out, meet with the folks, leave naloxone or Narcan behind for future use if necessary. And then there's Greener Pathways, the high-risk mitigation team, which also identifies people that have had overdoses or high risk for overdose. And they would do outreach and try to offer some prevention, some services, linkage to services. Linkage to treatment and healthcare. There's medication-assisted treatment. This is offered by Greene County Family Planning. It's now offered by Greene County Mental Health. It's offered by Twin County Recovery Services. There are rehabilitation facilities, detox facilities. Well, this would be, we're providing, sorry, this is showing linkage to rehab facilities and detox facilities. We don't have those facilities in Greene County. There are outpatient treatment, care coordination, case management, and mental health treatment. Also harm reduction, okay? Which we'll talk about more in just a minute. Harm reduction includes Narcan training and distribution, fentanyl test strips, and harm reduction work groups. And then there's also treatment court. This is an alternatives to incarceration program through the courts, the New York State court system. So there, for many years now, there's been a drug treatment court in Greene County. And there's also an opioid court coming as well, which I'll talk about.
Yeah, so this comes from New York State. This is comes right off the New York State dashboard, which indicates the number of doses of naloxone. So naloxone is given when somebody has respiratory depression, is no longer breathing. Naloxone reverses the overdose by literally going to the mu receptor in the brain and throwing off the opioid. So it's more powerful than the opioid, and it throws off the opioid and a person can wake up. Sometimes they need more than one dose before they wake up. But when you look at this, you can see that in 2019, between law enforcement and paramedics or EMS, 59 reversals were done. And in 2020, they were 86. And this is first quarter only for 21, they were 17.
Two more options.
Yeah.
In ODMAP, which is a way to report overdoses, it logged that there were 89 suspected overdoses in Greene County this year so far, with 54 administrations of Narcan.
So I don't know if you heard that, 89 overdoses and 54 Narcans given. Yep. Yeah.
So far as
As of this year.
So one of the ways that we approach people who are using drugs and are overdosing is a harm reduction approach. And harm reduction has a negative connotation. Some people don't necessarily agree with harm reduction, but I propose that harm reduction is a pathway for some people who are actively using drugs towards improving their life's outcome to a place and a time when they might be ready to stop. Maybe not the first, second, third, or fourth time, but maybe the fifth, sixth, or seventh. We don't know. We're not in their shoes. Examples of harm reduction that we use now include nicotine replacement. Somebody's smoking cigarettes and we give them a patch or gum or a lozenge. That is what harm reduction is. We're replacing a more harmful substance with something that's safer, helping them to recover and maybe not use nicotine, which causes, the harmful effects that lead to cancer and other diseases. Other examples, seatbelts, using speed limits, birth control, and flu vaccines. So harm reduction decreases the health risks of any activity without requiring you to stop the activity itself. It does not encourage substance use, and we do not force people to stop using, but it's kind of a non-judgmental approach to helping people to get on their path. And small successes can lead to big successes. So some examples of harm reduction in this county that are going on right now is the Narcan training and distribution. So in addition to law enforcement and EMS doing Narcan, we're training lots of folks in the community, people who have loved ones who are actively using so that they can reverse them. Fentanyl test strips, we've had a lot of buzz around this, and the reason why we did a campaign around fentanyl test strips is because there are a lot of substances beyond that which we assume have been shown to have fentanyl. For example, cocaine. So for a recreational drug user that thinks that they're using cocaine, actually are using fentanyl and they have died. So some of the top screens are showing that. Other substances, methamphetamines and other drugs, even I've heard of marijuana. So a person thinks that they're getting one drug, and in fact, they're getting fentanyl, and they respiratory depression, and they're dead. So the reason why we are encouraging the use of fentanyl test strips is to provide people with the knowledge and tools to be safer. This is a public health measure, just like we promote public health measures to improve the safety of lives of our community. This is another one of those measures.
Do you think the use of the test strip stops them from using it?
No, it doesn't necessarily stop them, but it can, maybe they would use less, or in the case of somebody who's using cocaine, maybe it would stop them. And Danielle, behind you, gave an example. If you want to go ahead, Danielle.
So some of the things that we've seen are recreational drug users, so not your daily users. Maybe they, once in a while, they get together with their friends or family and they use cocaine. One of the things that was reported to me recently, actually by a client who received fentanyl test strip from us, is that they tested one bag of drugs that they got at the same time from the same person. One bag of cocaine had fentanyl in it and one tested negative for fentanyl. So again, we don't always know what's in the drug supply. No, there is no safe drug supply right now. So having harm reduction measures so that people can make better choices, again, using less, maybe they won't use alone if there's fentanyl in it. There's, the never use alone helpline. You can use with other people or let somebody know where you are in the event that you overdose, that you can be revived.
Do you have no statistics to show that it has prevented somebody from using something that they want to use anyway?
Actually, there is data. Before we started this campaign, the New York State Health Department has been providing some of the funding for it. So there is data to show that fentanyl test strips do change behavior and they do lead to safer outcomes for people that use drugs.
So picking up the test strips doesn't automatically mark them as a user?
So the fentanyl test strips are distributed either in public health or through the peers. So a lot of what we do is get the fentanyl test strips into the hands of people who are in the community as trusted people. So the peers are doing a lot of fentanyl test strip distribution. Another example of harm reduction is testing for HIV and Hep C. There's appendix slides that you'll see at the end. We're not going to go over, but 48% of the patients that we've seen in our clinic who are in active drug use have had positive hepatitis C antibodies. So harm reduction, and then peer supports. So some good news, right? So it's not all bad news. One of the things that can save lives is medication-assisted treatment. So we talked about that new receptor in the brain. We use opioids and it depresses that receptor and we die. Medication-assisted treatment sits in that receptor site and replaces the opioid and is a more powerful seat in that receptor site. So medications such as, you've probably heard of Suboxone, buprenorphine, Vivitrol. Medication-assisted treatment providers have been increasing in Greene County, and this is an example of what we've done in the time frame from 2018 to 2021. In addition to having more prescribers, people are staying in retention, so greater than 6 months. So we're actually higher than the New York State, the other communities in the Healing Studies grant. So this is some good news. Support and recovery. So they're in recovery, they're in treatment. How do we help them? Well, Greene County Mental Health, certainly a lot of folks in recovery have mental health issues, and Jason's clinic is working hard with them. We are now partnering. We have a social worker and a nurse practitioner working in both clinics to support people in recovery. We have lots of groups in our community, 12-step harm reduction works and NA. We talked about the certified peer recovery advocates helping out in the community. And then the youth clubhouse, our youngest, most at-risk people. We have Kai here from the clubhouse if you guys have questions. Promoting really a drug-free lifestyle for these youth and providing alternatives to even initiating drug use. Remember from that video, the younger you are, the more likely you are to have your brain changed and the harder it is to recover. Future local efforts. So this is kind of exciting. We're excited about some of these things. Opioid treatment court. So there was a drug court, and this is a drug court that would be specific to people using opioids. The second one is a pilot program that is Greene County paramedics are working with the State Department of Health and OASAS, where they would initiate buprenorphine in the home for somebody that would be unwilling or unable to go to the emergency room. Fatality review team. So we have to look at the data of why people died. What were the circumstances? Danielle Hoteling and I are spearheading that. We hope that in the fourth quarter of this year, we will begin to have more investigations as to what went wrong and where can we make a difference? How can we improve? And expansion of the non-peer clinical peer supports in all of the agencies that are listed, including DSS. So this is another place that we know that folks in recovery are struggling through Kyra and downstairs. So there's actually a peer working in DSS right now. What are some of the gaps and barriers? Well, we don't have a recovery outreach center in Greene County. Stigma, when people feel that they're being judged, they will not seek services, and it's a huge, huge barrier in this county. That's one of the reasons we're here tonight to talk about it. We do not have an inpatient detox or rehab. We don't even have pain management. So somebody with legitimate pain who needs narcotics and other pain to help them, we don't have that service in Greene County. So people sometimes use illicit substances when they're in pain, and so it does work for pain. We don't have a methadone treatment program. The nearest ones are Albany or Ulster County. Funding, a lot of the work that we're talking about, some of it is funded through grants. Grants are not forever, so we're all cautious about that. We all have agreed that supported housing is a huge problem. When people are, we don't have supported housing to help people in recovery, it's really hard for them to move forward. Jason alluded to this, and this is really another topic for another day. There are high-risk prescribing habits for Greene County residents. That's some of the data that the healing studies community is uncovering, and we will be providing more updates on that as we have more clear information. And then access to harm reduction. So what can you do to help? So understand that addiction is a chronic disease, regardless of the cause. If we have somebody that has diabetes and they have a chocolate bar, we don't yell at them and say, you can't have chocolate, you have diabetes, you can't do that. So we really have to kind of rethink what is harm reduction and how do we not stigmatize people who use drugs and then not use drugs and then use drugs again. The word addict is not helpful. So a person who uses drugs is a lot less stigmatizing. We don't use the word clean. People aren't dirty. They're using drugs. So substance free is a better way to say it. Remember, it's a long path. There's stops and there's starts. Remember that harm reduction saves lives. And Greene County is getting this funding now because of the problems that we have in our community. And that's a good and a bad thing, to be honest. Please support your constituents in recovery. Become an advocate, get trained in Narcan. You can even do Narcan training one night here if it's of interest to you. Know where to refer individuals that are using drugs. And help us with continued data sharing and collaboration between agencies. That's something that we're struggle with in this county. The overdose maps data is only as good as the people putting it in. And Pete was one of the first ones a couple years ago to say this is a great service, and I use it as a New York State police. We appreciate that, but the data around overdoses is only as good as it is when it's entered. Finally, we want to say thank you for listening and taking time. You'll see there's a number of appendices. We will be emailing this to you so you can look it over. And in the appendix is what each of the agencies individually is doing around this with some numbers and some how to contact us. So, thank you.
Thank you.
Jason, I have a few questions. The group here that's involved in overseeing this and bringing this together, how often are you getting together?
We meet, we interact in various arenas over various meetings pretty regularly. Yeah, we don't have a specific one specifically just to address this, but we're constantly overlapping.
Would you say how often have you gotten together and said something's not working that we're doing? That's been funded that we're doing. And I can only just see what you showed here on these graphs. We've seen the graph go up for drugs that replace some of the hard drugs that people may be using, but our overdoses continue to increase too. So you'd like to see that go up and the overdoses go down. So at what point when you get together do you say that's not the solution? You need to look at something else. And then you saw the graph from New York State, and we're in blue, and a county of similar size, and I can only say it as Herkimer County is in beige. And what are the services they have as an example, Herkimer, do they have a resource center, or do they have things that we're lacking that have been proven to improve outcomes for people who are addicted to drugs?
If I may. So one of the things that we encounter a lot is, I mean, this is kind of the provider team back here, and we work closely with the sheriff's offices. We actually don't have data sharing agreements where he can call and say, hey, Danielle, we have an overdose. Can you send one of your peers? Or, hey, Katie, we have somebody, can you send them? We can't do that officially. So that's why the ICP program was developed, so that they can sign a release form and get that information to us. But again, the numbers there are small, and also state police so there's other responders that are getting the information that doesn't come to the sheriff's office, that doesn't get to us. So OD map shows, like the regional view, so we know where can we put the greener pathways RV to do outreach for naloxone dissemination, for example. But that doesn't give me Joe Smith that lives at 123 Main Street where I can go knock on the door with a peer to say, hey, can we connect you to any services? So that would be, I think that's one of our biggest issues, is the lack of the data sharing, which I think we're gonna talk more about with our fatality rate board and some of the other initiatives that we have, but I would say that's a huge gap for us.
Another big gap we have is we do not have a medical examiner in the public health staff. So in Ulster County, they have a medical examiner that every one of the overdose deaths toxicology report comes back to the health director, and they can look at that and say, this is what they actually died of. We are struggling to get that information, and we're working on several avenues to try and get it, but that's definitely a hindrance to this community.
Is that because of healthcare privacy laws, or?
No, it's just a glitch in the data, and primarily it's because we don't have a medical examiner on staff. We have a medical examiner that reports the tox screens, and the coroners get them, but they do not make it back to the public health office.
And the delay in some of that, like even for suicide data, you have to go through each and every death certificate as it's updated, and some toxicology reports take years. So even looking at suicides and overdoses, like that information is not time sensitive 80% of the time. And going back to the sheriff's office, like we came to the county and said, how do we help this? We know that overdoses are happening. We as providers don't know how to fix this. And there's no data sharing that happens. And even for the sheriff's office, getting information on overdoses is not an easy task. They have to go to the individual agencies, try and track down information that they're going out in person and trying to connect people to resources. Then if they make contact, they get referred to us at Mobile Crisis, and then we try and get those referrals out and get them connected to where we can. But it's ultimately like you have the same staffing crisis that everyone is in right now, where we're trying to do the best we can with what we have. And we've lost the war on drugs. Like I do trainings with the sheriff's office in different counties, they will tell you we have lost the war on drugs. We now have to look at all of these other services, all of us as providers, to say, how do we help fix this? For anyone who was out there with the DEA training not a few years ago now, probably, and they said they're maybe getting 15% of the fentanyl, carfentanil, those heavy hitting drugs of what's actually coming into the country. It's about 15% of what's actually coming in. If anyone has better numbers, that's what I remember.
So 85% is getting.
85% is getting through. And that's with the DEA, and that's who's informing us of what are we doing. So we've lost the war on drugs, and now we're just doing damage control. When you look at the prescription writing, which was a huge national, there was a huge article about the family about prescribing, opiates were prescribed as a non-addicting thing. When you look at how it hijacks the brain, it's super addicting. And it changes your brain chemistry. A person in recovery, it takes 2 years for them to not use any substances to be in true recovery, even just for their brain to reset to normal patterns. I mean, look at how opiates keep hitting your brain. I applaud everyone in recovery because this is hard. And as providers dealing with this is hard. And this is our community. We're super high in the state, so we're trying to do the best we can.
When you talk about prescribing of the opioids, have you gotten any commitments from the medical profession that serve Greene County about trying to limit as much as possible
The
prescriptions?
the prescribing, the data that shows the prescribing habits to the residents of Greene County is pretty concerning, and it's actually being looked at now by the Department of Health. So that part is kind of, I mean, it's not in our realm anyway, but it's being taken from us and looked at very closely, and I don't know what will come of that, but they're looking at that, they're taking that into their hands.
And the prescribing starts years ago, like working in the health field, like, pain turned into a vital sign. What's the issue with pain is it's subjective. You can look at someone and they can tell you that they're a 10 on 10 for pain, but the reality is they're sitting watching TV, eating, dinner, and it's like you have to take it for what it's worth. And that was pharmaceutical companies, you can get into the history of that, but that's like truly when you look at that, our prescribing is concerning, but this has already started 10, 15 years ago. 20 years ago.
And I think to get to your original question as well, we all collaborate very closely together. I kind of hesitated when you asked we meet together regularly. We don't get to meet together just to talk about this. We're meeting like multiple times all the time about different things. So we're pretty critical. We're constantly critically looking at and assessing what's being done. And I think Katie's statement about losing the war on drugs, I mean, we feel like we're doing what we can do to address this problem. And all of the interventions we're doing are evidence-based interventions. They're research-based interventions, whether it's the treatment, MAT, harm reduction, Narcan. These are the things that are being recommended to help address this problem. So that's what we're doing. And this is a grave concern that, what we're showing you on here is, there were a couple positive slides, especially with the MAT, and we're expanding. We feel good about what we're doing. We think we're doing things that are helpful, but the problem is big and vast.
Jason, just going back to a statistic, 89 overdoses was mentioned earlier. Are they all opioid related?
Do we know that, Katie? Where did
I
that?
think the majority were opioid related.
You said 54 Narcan were used.
Yeah.
Is that because the other ones either were not close enough to get Narcan recovery, or because there was some other drug?
Narcan could have already been administered by someone who's not
It didn't work?
reporting in. It could have worked, but it wasn't reported into ODMAP. It would be by like a bystander or someone like that.
A friend of theirs.
A friend of theirs, right? Family, could have been administered by someone else. We do have them. They go in sometimes if they're alcohol, we have to tease some of that out. I know the majority are opiates.
Yeah, so really, the limits of ODMAP data is as suspected by law enforcement or first responders on the scene. So if somebody from the sheriff's office shows up and there isn't drugs on the scene, and somebody's not saying, hey, my friend, took whatever, then they may not know. So it's really what's reported to them on the scene or what they find on the scene, and sometimes we don't always know, or it's not entered in some
And
cases.
the autopsy results are not getting back to you, so you don't know what it is anyway.
Well, and before, you have to remember, if someone overdosed in the field and EMS went out, they could titrate the Narcan and bring them to the ER and at least have them evaluated in the ER. Now we don't have that. People are getting instant Narcan, they're revived, and then they can RNA, so they can leave without any kind of medical transport. Doesn't mean they're not going to overdose again later and have to have Narcan done again. You can't titrate it anymore. Just can't give it in small doses to get them transported.
We really have used a lot of your time. This was made way longer than we had anticipated talking, so I apologize for taking longer, but are there any further questions?
No, I think one of the positives I see here, just thinking back over the past, is now compared to even 2 years ago, we had all these segmented agencies that were all trying to do their thing. I don't know that we had the collaboration that you've got now. And that's why I have to look at that graph. It's a positive graph, and think, that, yeah, something was done positive for 2 years ago, whether it was the initiative employee and, the mental health cooperation agency there, but I don't know if that's it for sure, or it's just that a collaboration is what seems to really bring out the good ideas, really hit it, and make sure you're hitting as many people as you can. So thank you for working with that, all the agencies.
And Ted, I think you've done a great thing. Like, you guys supported the Columbia Green Addiction Coalition in that position. Danielle was the person, and that was a lot of organizations. I truly thank all of you for your support in that.
Yeah, it just doesn't come quick. It's not a spike. It's that gradual.
We certainly didn't get into this problem within a few years, and I don't know that we're.
Thank you.
Thank you. Thank you very much.
Thank you.
We also have with us this evening Kim Kaplan. Kim, give us an update.
Hi, good evening, everybody. I just wanted to give an update on where we are with COVID and any questions that you have. So today's positives as of the middle of the afternoon, we had 97. I know that it continued to rise after that. Just for comparison, on July 2nd, we had one active positive. New positives today were 21 and rising. They're still coming in. We have 2 in the hospital right now, 78 deaths, 109 on quarantine, no longer including travelers. Travelers no longer quarantined. And our 7-day rolling average is 6.7. I remember when 4 was that mark that we were all looking at, as a cutoff. So that's 6.7. For vaccination rates, the percentage of the total population, so that includes everybody, even that's not eligible, who are fully vaccinated is 52%. Age 12 and over, so that's everyone who is eligible, 58.5%, 18 and over, 59.6%, and the percentage of the population, 65 and over is 75.6%. And that's fully vaccinated. Does anyone have any questions?
Kim, you say COVID, is that the variations as well?
Yeah, now it's mostly the Delta variant, mostly right now. That's not to say that it won't change. It's always shifting, but it went from being a small percentage to almost the whole thing in a very small amount of time because the Delta variant is very good at spreading. So it took over as the major variant very quickly. And there are several variants considered variants of interest, meaning they're prevalent, but nothing to the extent of the Delta.
Are you keeping track of those unvaccinated and vaccinated catching that particular variant?
We don't get to see in our positives who has a variant. That's done at a state level and a national level with surveillance. So while they really surveil all of New York State, we don't get to see that, Jane Doe was a Delta. We don't get to see that.
Kimberly, is your office still tracking?
7 days a week.
So is there a certain hotspot?
Is there a hotspot? You know what? It
Is
shifts.
it another nursing home or? Is it?
No, we're not in the facilities right now. So we have had, the Delta variant spreads really efficiently. So where you have a positive in a work site or a camp or any kind of place where people are congregating, it tends to go through the group really efficiently. And, you see that in the household too, whereas earlier on, if everybody was careful, you could avoid some of that household spread. Now it's really hard to do that. You have to be really diligent and lucky. But don't forget that the spread starts before anyone is sick.
What would your estimate be, or do you have estimates of people who contracted the virus and now have natural immunity, and the natural immunity along with your total vaccinations, a percentage of our population might be?
The natural immunity following infection is finite. It's thought to be about 3 months. Some people might get a little more out of it. Some people, not as robust an immune system, might get a little less out of it. But it's really considered to be 3 months. After that, it's really not a factor. And I think that's something that, at least when we talk to people and interview people, a lot of people are not aware of. They'll say, oh, I had COVID last summer, summer ago 20. So I'm good. It's, not a factor anymore. It doesn't help anymore.
Kimberly, you know more than that. That's your profession.
what you deal with. Right? One thing, person that I see is on TV. And, you know, oh, now you're gonna need a booster, you might be, you never get a clear answer. Where do you, and this is not a, you know, a question where, you know, you're gonna be told anything. Just asking your opinion, because you're so involved.
On the booster?
On just COVID itself, you know, this Delta, have you, you know, you fully 2 shots of vaccination, and, you know, there's people that have been vaccinated, they're still getting it, and then we're told that it's not as severe, you won't be in the, you know, but ER or whatever. And people don't know, because what we see on the networks and reading the media, everybody, not a lot of questions, but I get questions about people just, they're so confused.
Yeah, the media has a lot of, there's just a
Yeah.
lot of there's a
There
lot of
is.
media now. There's just so much media
Yeah.
now from every direction. But it is apparent that people who are fully vaccinated are less likely to become very ill, hospitalized, or die. That's protective. Is it 100% protective for every vaccinated person? Well, there are people with, you know, different susceptibilities and vulnerabilities, and maybe it will not save them. But generally, it's really going to make less likely to get sick, especially with different layered mitigation, wear your mask and fresh air and outdoors and all those things. Less likely to get COVID, and less likely to become very ill from COVID. So that still does have value. The boostering is still being discussed.
Thanks.
In regards to the booster, I know it's all still kind of an evolving thing, but I know the governor yesterday did say that the boosters, that amazingly enough, the counties were going to be allowed to, or are going to be the ones to roll the boosters out, because that's our wheelhouse, it's what we do. In stark contrast to what we saw when they first came out. Are we going to have access to the data that says, you know, first responders that live in Greene County who were inoculated in Albany Med? Are we going to know who those people are so we can get that out, or the people who are done at state sites?
Well, we can, because there is a database for the state, so we can look up people's vaccine status. And the way it's working now is people with certain medical vulnerabilities, people who are immunocompromised in certain categories are eligible for booster. It's not a general recommendation, but yes, it will have to, because you need a certain duration from the last vaccine of the 2-dose till you get your booster. When that becomes the recommendation, that we'll have to really roll it out in waves. And right now also they're saying that you will get a booster of the dose that you got before the brand that you got initially. So we'll see. All of that is still being worked out.
And I see our registration list was started back up for that, for those people who've been immunocompromised.
Yes, that's exactly right. That's exactly right. And we had a good turnout for that. And people are also doing that through their pharmacies. I've spoken to people who are doing that through their medical providers where that's available.
Yeah, I guess my concern a little bit is some of these pods that we did were 600 or 700 or 800 people.
Yes.
And we may wind up now with an extra 150 or 200 on top of that who were vaccinated elsewhere.
Yes.
That are now going to be done here.
Would it be helpful to have other sites? Absolutely. It would be helpful to have other sites. But we'll see how that is. I know a lot of the big state sites closed. When the demand was diminished, a lot of the big state sites closed.
Kim, on this vaccine shot.
Yeah.
And they're talking about a booster shot. Is that the booster shot basically like your yearly flu shot then?
Yeah, so that's really because the response diminishes. The flu is a little bit different because the flu has now been an annual event for a long time. So what they do is they look at the flu in other parts of the world, and as that flu is evolving, it's getting towards our flu season, they formulate the vaccine. Now, it can keep evolving and there's less good of a match, or it could stay a little bit stable and then they can have a very good match. So we're not at that point yet, but they're finding that it does diminish somewhat over time, and it may be because of the variant, there's a lot of different factors involved in it. But that's the premise of a booster.
So say people follow through with a vaccine shot, get their 2 shots or the single shot vaccine.
Yeah.
And then say 8 months from that time of that vaccine, and they go and get an antibody test.
Uh-huh.
And the antibodies are still high.
Right.
Would would that negate the need for a booster shot?
You know,
Or
we're being
this
told
yearly?
no, we're being told it doesn't. Well, it's good, it's not exact enough of science to really be able to hang your hat on that. So, you know, I think that some of that is just not specifically worked out yet, but we are being told that an antibody test does not negate any of the other findings.
Thank you.
Thank you very much.
Thanks, Tim.
One proposed resolution this evening, authorizing agreement, Greene County Public Health and New York State Department of Health COVID vaccine response contract number C-36933GG.
Davis.
Davis?
Over.
I have a question for the board on that, Pat.
Yeah.
What is this, I mean, I understand what I'm reading, but I'm not aware of any discrimination that's happened to anybody in this county. If they want vaccination or need advice, what's this 20%? If anything, in the beginning of this whole pandemic, we were the ones begging the state for shots and they were circumventing us. So for this here, it's kind of hypocritical, my own opinion.
You know, I don't know, the same thing, you know, the New York State, when they put these grants out, they do it for everything. If you look at some of the ones the sheriff gets or emergency services gets, sometimes they have the same type of 20% requirement. It has to go toward anti-terrorism initiatives. And how many terror attacks have we seen here?
Well, I guess what I'm saying, Mr. Chairman, is I look at everybody in here as residents and Americans, no matter what your ethnic background, religion, or your race or gender. So it should be, here's the funding for 20% more participation towards COVID knowledge and being vaccinated. I don't think that it's correct to put an ethnic group or a racial thing or a label on somebody.
I don't know if it's correct, but it's part of the grant process. And it's actually part of our COVID vaccination plan that was written up in, what, December 19, I think it was. It's actually written in the plan. So, you know, it's not like we'll have an issue meeting that requirement, but it's their requirement, it's not ours. In order to get the funding. Or is it, or Kim, is it difficult to put a number to that as you're doing vaccines?
No, it's becoming, you know, like all the grants, it becomes more specific as it gets, you know, closer. And it is actually, we got it now, but it predates to January 1st. So we've done a tremendous outreach, you know, homes for people with disabilities, and, you know, any homebound client, and we really tried to outreach into the community, so I don't think we'll have an issue. But this is actually a more, even though it says COVID, it's a more general vaccine grant, so it has to do with access to vaccine for COVID.
It's not just COVID.
Not, this one's not for COVID.
I don't know if that answers the question, Tom.
Just another layer, just bureaucratic jargon, that's all inside them, just, I don't agree with the wording. I think the whole thing's a good idea, good grant. Just my opinion.
We had a first by Davis and a second by Warner. All in favor? Opposed? Is there anything else to come before my committee?
Motion to close. Madam Chair, it's only 6:55.
I have 5 more minutes.
Figured an hour.
Closed. Wow.
Right?
Thank you.
Oh, thank you, Tammy. I'd like to call county resources to order at 6:56. We have one agenda item here. This is appointing a member for the Columbia Green Workforce Development Board. Susan Summers Evans, she's the Director of Human Services with Wyndham Mountain, and that represents our business community. I need a motion on this.
I'll move that.
Overlaw, seconded. Any discussion? All in favor?
Aye.
Opposed? So carried. Any other business come before county resources this evening?
Motion to close.
Overboard to close.
Second.
Second is Rivera. You are closed. Thank you.
Good job, Mike.
Good evening, everybody. I'd like to call the Public Safety Committee to order at 6:58 PM. There's no agenda items for the month of September. However, in attendance tonight, we have Sheriff Kuzminski with the monthly report, and who's accompanied with Superintendent Holmes in jail.
This one quick. Make up for the last. All right. This month, we did 130 civil attempts, served 63 civil papers, issued 75 traffic tickets, investigated 30 traffic accidents, made 19 arrests and 3 DWIs. We handled 473 calls for service and made 151 traffic stops. On to the jail. The transition team is continuing their training scenarios and are conducting facility shakedowns. The final step in the process to open is the approval of our move day plan. There was an outbreak of COVID at the Albany County Jail, which may have played a role in the delay. Our inmates who have been quarantined will all come off quarantine this week. The commission is coming on Tuesday, so we should have more info then, but we anticipated it would be imminent. Leave the dates off because we don't know. On August 1st, 21, the starting jail population was 27. On August 31st, it was 34. The corrections officers did 66 transports, traveling 6,577 miles, totaling 141 and a half hours, moving 65 inmates, and we have 2 state-ready inmates waiting to go to NISTOC. We did have our award ceremony this past month, and I want to thank the chairman and the other legislators who attended for their support. We did also have a busy month, and I'm sure John's going to add on quite a bit, but including the heavy rain and winds from Tropical Storm Henry, our deputies were assigned to the EOC and assisted with rescuing several people from vehicles that became stranded in flooded roadways, and the total actually was 7 from 2 vehicles. That's all I got.
Pete, just out of curiosity, do you have a number on DWI arrests year to date?
Not off the top of my head.
I just
For the sheriff's office, yeah, you know, we're between 1 and 5 a month.
I didn't know correlating to the opioid issue we're having, and is it on the same kind of path, you know, or is
No, we're pretty steady.
DWI is kind of going down and opioid, you know, overdose or whatever going up?
The opioid, that's a very complicated issue, as they try to explain, because the more we're actually doing more reporting now, so that might, and we're not getting all the ones that, you know, have overdose and they have home issued Narcan. If it doesn't get reported, we don't know about it. And I would think that that's quite a bit more because of the availability of Narcan. So, you know, we also have the marijuana legalization thing coming. So by December 31st, they have to decide whether those municipalities are going to opt in or out on that as well. Have a great night.
And from the 911 center, we have Director John Farrell.
Good evening, everyone. Before I go through my short report, I just wanted to, sitting in the back here, in regard to overdose. This morning, I had a young lady come in my office. Apparently one of those calls was at her residence. And, the individual wasn't breathing. So I just want to share with you what she said to me this morning. She says, I want to be able to thank those 11 agencies that responded within minutes to my home to bring him back. So as you see the teamwork that was just presented, and the teamwork that's out in the field that gets dispatched to the 911 center, it's just unbelievable how we're all linking it all together. And it's just amazing. And to have her come into my office, she was just extremely happy with the results. So moving forward, I spent most of my day with the national weather. Over tonight's storm, very, very happy to say that as of right now, it continues to stay between 8 o'clock tonight through 5 will be a heavy rain. We're going to continue to have no more than 2 to 3 inches, 4 inches possibly up in Hunter. Mary's home.
Having cousin there,
but I have to say that if it shifts, we could be in trouble. But the way the national weather talked to me at 5:15 today, they feel very positive staying down in the southern end of Ulster County, south of that. This past Sunday, Dispatcher Roy Chamberlain, with 30 years of service, gave him a nice little walkout. Great results from the fire service, the EMS, and law enforcement agencies in their line of march with their vehicles and so forth. And was probably the best part of the day for him was his daughter, who lives in Denver. She flew in as a surprise, and we put her in Baltimore's fire truck, and the truck pulled up and she jumped out, and I think it was a great time by all. Back on August 22nd with that storm, as we had the conference call on Sunday afternoon, thank God, I know myself, I stayed till midnight with the crew. We brought in extra people in the 911 center, and it was really nice and quiet. But I have to say that during that time frame, we did have 7 water problems, pump outs, 2 water rescues occupied in vehicles, even when the roads are closed. I can't even believe it, but they drove around, and can't say enough to Kiscaton and the sheriff's office and law enforcement for handling that situation. And we had electrical hazard, 1 of them, and 8 wires down. For more important, Dan and I, we worked today together. By Friday, we have to have a total of preliminary damage assessments to pass on to FEMA on Friday afternoon. In the county of Greene, we have to come up with $191,000 to meet our quota, and $30 million across the state. But as of right now, I have Catskill and Wyndham towns, and a total of 33,000. So far, I heard from the village and the town of Athens, village and town of Coxsackie, and village of Hunter. And tomorrow I'll reach out to the other towns just to make sure that they have, before we send the report in on Friday. Normally on 9/11, we do our normal program out in the office. I'm working with the Baltimore Fire Department. It's the same day as Greene County Volunteer Firemen's Annual Parade. And I've been working with John Wallace, chair, and everything's pretty well all set for up there. It's going to be a little bit shorter program than normal, but I think that's the best spot right after the end of the parade. Probably 4:15 We'll do a 9/11 program right there with all 27 fire companies and guests. And I think it'll really be a good afternoon. On top of that, a few months ago, I mentioned about Carl Phillips. He was our state fire instructor, spent 15 years here. We're going to do a special presentation to him. I talked to him last night. He will be present along with his family. And Carl was an outstanding instructor for our young firefighters just going into the program. And the one thing that I'm going to do also tomorrow is reach out to John Wallace, because next week is Greene County Firemen's Convention. Press doesn't really show up for too many events. And you know, if you were with me last Saturday night, when we had 11 fire companies fighting fire in Rolton, everybody's asking me all day, why 11? Because we didn't have enough manpower. A lot were on vacation. And you see the way all the fire companies work together from 2 o'clock to almost midnight. And we need to have the press put a good article about this coming convention, because this is the time fire companies should be really recognized for the Firefighter of the Year program that they do. And there's a lot that that association does. So I'm going to reach out to John. I don't know if he's already touched bases with the local press, but we need to make some noise and let the taxpayers in this county realize the value of these individuals. And we take them for granted until that 911 call comes in. Just last week, the team went, that whole building, what we had to do to put that fire out. And God bless them. But I certainly will reach out to the press to make sure that they're.
Mike Ryan is on right now. Mike Ryan, did you hear that?
I heard it loud and clear. Please get in touch.
I'll call you tomorrow. Thank you, sir.
All right, thank you.
So that's all I have. I have a full crew. I brought 2 more in tonight in the 911 center because of the storm. Just to make sure we're on top of our top of all issues facing that. And, normal business for us anyway. And I also just want to say, Sheriff, thank you for supplying the necessary help on that Sunday night. Really appreciate it.
Yeah, so your latest forecast is we're gonna dodge it, right, unless it changes.
Unless it changes.
So you must have a plan, right? If it does change, you're gonna act the EOC at a certain time, or?
Absolutely. When I get home tonight to have dinner, I'll be calling the National Weather Service up and get an update. Dan was going to be here tonight, but at 6 o'clock there was a conference call, and I haven't heard from him, so I'm gathering that there was no news. Good. So
He came off vacation early for the last one too.
what's that?
He came off vacation early for the last one too.
It is what it is.
It is what it is. He was here.
Thank you, John.
Hey, thank you. Any other questions?
Thank you, John.
Have a nice Labor Day weekend.
Okay, so before adjourning, it's my understanding there's a personnel matters that need discussion, and I'll make a motion to go into executive session. Can I have a second? So, Bueller?
Oh, maybe I can't because I'm not on public safety committee.
I'll second.
No, Chairman Lane.
All in favor?
All in favor?
Aye.
Opposed?
Executive session, and then no business will be taken care of after the